It's Monday, December 16th, and this is the Daily Medical News, where we bring you the top stories in clinical medicine, as well as a closer look at the day's biggest story. I'm Terry Rudd, filling in for Nick Andrews. Today, do women with diabetes need more cardiovascular risk reduction than men? How the emergency department could help more opioid users find their way to addiction treatment. Liraglutide could help stall the onset of type 2 diabetes in children. And why your mother's advice could be key to preventing dementia. Should cardiovascular disease risk reduction efforts be more aggressive in women than in men with diabetes? That depends on how you interpret the data. During a debate at the International Diabetes Federation 2019 Congress, two experts discussed the degree to which gender should determine the intensity of CVD risk reduction in patients with diabetes. Dr. David Simmons is an endocrinologist at Western Sydney University in Campbelltown, Australia. He says diabetes erases the well-described life expectancy advantage of 4 to 7 years that women experience over men in the general population. And the heightened CVD risk is of particular concern in both younger women and those with prior gestational diabetes. But Dr. Timothy Davis counters that the data only show that the excess CVD risk that's attributable to diabetes is higher in women than men. A closer look reveals that the absolute risk is actually greater in men. Dr. Davis is an endocrinologist and general physician at Fremantle Hospital in Australia. He adds that, at least in type 1 diabetes, there's no evidence that more aggressive cardiovascular risk management improves outcomes. For an in-depth discussion of gender-based CVD risk in diabetes, click the link in the podcast notes. Emergency physicians can be persuaded to follow a recommended strategy to prescribe buprenorphine in patients with opioid addictions and refer them to follow-up care. That's the word from Dr. Catherine Hawk, assistant professor of emergency medicine at Yale University in New Haven, Connecticut. Speaking at the annual meeting of the American Academy of Addiction Psychiatry, Dr. Hawk explained that both the American College of Emergency Physicians and the American College of Medical Toxicology have endorsed the use of buprenorphine in the ED as a bridge to long-term addiction treatment. But emergency physicians have been reluctant to start prescribing buprenorphine and get more deeply involved in referrals to addiction care. A 2017 to 2019 survey found that only 20% of emergency physicians said they were ready to initiate the buprenorphine treatment protocol. Dr. E. Jennifer Edelman is an associate professor of general internal medicine at Yale. She says there are effective strategies to bridge the gap between the ED and addiction treatment. One idea: invite emergency physicians to observe a treatment initiation. Having addiction specialists show how to counsel patients to start medication at home could help facilitate those practices in the ED. And addiction specialists could give emergency physicians feedback and follow-up on the patients they refer. The FDA's recent approval of liraglutide in pediatric populations could bring new hope for children and adolescents with type 2 diabetes. That's the assessment from Dr. Sonia Caprio, a pediatric endocrinologist at Yale University. She spoke at the annual World Congress on Insulin Resistance, Diabetes, and Cardiovascular Disease. 2018 consensus guidelines from the American Diabetes Association call for administering metformin twice daily in youth with new onset diabetes who have an HbA1c level of less than 8.5%. But metformin's effectiveness in young patients is debatable. The NIH-funded Today trial treated nearly 700 pediatric diabetes patients with metformin plus other therapies. Over the course of 11 months, the researchers found that 46% of the children were failing treatment. And the worst arm was the metformin arm. Enter this year's ELLIPSE trial, a randomized placebo-controlled study that evaluated liraglutide's effect in children and adolescents with type 2 diabetes. All of the patients also received metformin. At 52 weeks, Dr. Caprio says the liraglutide patients' declines in HbA1c levels and BMI were significantly greater than placebo. For Dr. Caprio, the results herald a new era. Finally, she says, there's something else to help children and teenagers delay the complications of diabetes. We'll be back with more medical news after this message. After 15 years of disappointing drug trials, strong new evidence says the best way to attack Alzheimer's disease is not to treat it once it develops, but to prevent it in the first place. That's the message Dr. Laura Baker of Wake Forest University in Winston-Salem, North Carolina, delivered at the Clinical Trials on Alzheimer's Disease conference. That means that to prevent dementia, follow Mom's advice. Get up off the couch, go play with your friends, and eat your vegetables. Dr. Baker says studies of exercise, cognitive and social stimulation, and diet show that each one can reduce the risk of dementia. And a combination of all three may have an even more powerful and synergistic effect. The general benefits of exercise, chiefly aerobic exercise, are myriad. Dr. Baker explains that exercise increases effective neural repair and reduces oxidative stress. Plus, it reduces inflammation and increases normal clearance of amyloid beta. Diet mediates dementia risk through less direct but very effective pathways. Diets rich in vegetables, berries, nuts, fish, lean proteins, and healthy fats improve virtually all metabolic measures. Those, in turn, reduce the risk of cerebral vascular disease, an important driver of vascular dementias and a contributor to Alzheimer's disease risk. Cognitive stimulation and social interaction also appear to modify dementia risk, although the data are a little more limited. If one lifestyle change can reduce dementia risk, what happens when all three work together? The Finger study in the mid-2000s found that the triad of exercise, personal support at the gym, and a modified Mediterranean diet reduced Alzheimer's disease risk and improved cognition relative to the control group. Dr. Baker cautions that no matter how compliant people are, lifestyle changes will never completely rid the world of Alzheimer's and other dementias. But lifestyle interventions may help drug therapy have its maximum effect. And that's it for today's Daily Medical News. Remember, you can find us on Apple Podcasts, Google Podcasts, Spotify, Pandora, or wherever you get your podcasts. For MD Edge, I'm Terry Rudd.